Right, because there's not that many of you, it would be lovely if you could unmute and just come off video so I can just see you and answer any questions. Perfect. So there's a few of you I can see. So what I'm going to do in this workshop is just run through some of the exercises that I was talking about in this morning's presentation. So some of the exercises that we taught in the Holt trial, but some of the things that are safe and appropriate for you to do from any time, sort of 2 to 3 weeks post-surgery, all the way through forevermore, and particularly if you've got a hernia. So these exercises we know are safe and appropriate, and this is what I teach also in my Ostomy studio workshops. So, has anybody got any particular questions before we get started? Just if you just come off mute and just ask me, because there's only a few of us in here, so we can. Yeah, go ahead, Louise.
My husband Ron, he had his ileostomy February the 11th. Is he okay to do these now?
Absolutely. Can he get onto the floor, or is that tricky for him?
No, easy.
Yeah. Okay. Don't demo. I'm going to no stop. It was a question. Yes, he absolutely can. He'll be fine. Anybody else got any questions before we get started?
Yes, me.
Okay. Is that Alison?
I noticed that you're on the floor. I have serious knee problems, back problems. There's no way I would be able to get down on the floor. Is there an alternative?
I can't see you, but are you in a room where there's a bed? Can you lie on the bed?
I could lie on a bed, yes.
Okay, so if you want to do that, that would be an option. For this demonstration today, I am doing it on the floor, but there will be some alternatives for seated exercises and standing exercises, and I'm going to run through a few of those as well. But if you don't have a bed next to you, why don't you just watch this workshop, and then it's recorded so you can come back and then have another go when you're somewhere where you've got an appropriate place to be, okay? So being on the bed will also be an option.
Sounds brilliant, thank you.
Okay, but I'll do some seated and some standing stuff as well, so you don't have to lay on the floor. But for today, we are going to get onto the floor. But before we rush down there, I just want to kind of give a few questions. So at least 2 weeks post-op, but to be honest, you'll be fine anyway. I want you to listen to your body. If there's anything that doesn't feel right, then you stop. And this is very much sort of like a two-way process. So if there's something you're not sure of, just come off mute and just ask me. It's going to be quite an informal, kind of just a bit of a mashup of trying a few different things and seeing what feels right. So before we get started, I'm going to talk to you a little bit about what intra-abdominal pressure is and why it's important. So when we think about our deep core, we've got our diaphragm and we've got our pelvic floor, and they work like a sort of unit, so they move together. So the diaphragm is this big muscle at the bottom of the ribs, and it separates the lungs from the abdomen, and the pelvic floor is a sling of muscle, and that sits right at the bottom of our pelvis, and that's responsible for our continence. And sometimes if you've had surgery that's involved rectal removal, you'll have had surgery to your pelvic floor where you've had your anus stitched closed, or you may have even had some kind of reconstructive surgery down there. Yeah, so it's really, really important that we understand the relationship between the diaphragm and the pelvic floor. And we start by doing that with learning how to breathe. So this function of this deepest core is the most important thing we can do after surgery. Before we start getting into this kind of really sexy strength exercises, we need to understand this relationship. So we're going to come onto the floor. I'm going to do some breathing, and we're just going to learn how to connect this muscle. So want to make sure you come down to the floor safely, and make sure that you've got some kind of cushion or towel just for behind your head when you're laying down. We're going to come onto our back to start with. Now, to get onto our back, we don't just lie down and roll back. We're going to come onto our side. And so if you're not somewhere where you feel safe or you don't want to come onto the floor, then just watch. If you want to have a go, we come down to our side. We take our weight down. Our head comes to the floor. Then we roll over. And that's a kind of what I call a stoma protective way or an abdominal surgery protective way to roll over onto your back. If you're getting in and out of bed, do the same technique. So the weight of your head needs to be supported, then you roll. Okay, so we're going to start in this position. So we need our knees bent, our feet flat. And we're just going to learn this relationship between, we're going to start with diaphragmatic breathing, which basically starts to try and understand what's happening at the diaphragm. So we've got this muscle under our ribs, under our lungs, and we're just going to start to see if we can get it to move a little bit. So put your hands around your ribs, just feeling your rib cage. And I want you to take some breaths. So we're going to breathe in through the nose and we're going to breathe out through the mouth. And as we're doing that, I want you to feel your ribs expanding wide. So like your ribs are an umbrella, and we're opening the ribs wide and we're closing the ribs back down.
Put your hands on your stomach.
So we're feeling the breath. So as we breathe in, the ribs open and expand. As we breathe out, the ribs come back down and close. That might not be so easy, because what happens after abdominal surgery, we want to breathe into the upper chest, and we want to breathe into the lower tummy. We don't want to go near this abdomen. So you need to focus and consciously try to see if you can get those ribs to move.
Ribs.
So you want to feel a bit of expansion of the rib cage. And then as you breathe out, and it's a very flowing, gentle breath. It's not a, just allow that breath to come like a wave. So we breathe in gently,
Breathe in. That's not
feel the ribs come wide. And if you've got someone with you, they could even feel your ribs
nose
and see if you're getting that lovely movement.
and out.
And then breathing out. Can take a few times to get that. Okay. So that's our basis of diaphragmatic breathing, is just this trying to get the ribs to open and close. You might find it easier if you're sitting up in a chair or even standing. You can do it in every different position. Now we're going to try and see if we can get some connection through these deep abdominal muscles. So when we're breathing, what we mustn't do is then breathe out and then let the belly pop up. So if you just look at my tummy here, breathe in, and then switch. So it's almost like you're popping your breath, you're moving your breath from your lungs to your lower tummy. That's what we don't want. We want to try and get the breath to come out of our lungs and to flatten our tummy. And what we're doing here now is starting to connect the deep core with the diaphragm. So we take a nice breath in, we breathe out. And as we breathe out, the ribs come down, but we also start to feel like we're flattening the tummy. We don't want to see it rise. So just keep practicing that. It's a bit tricky to get to start with. Just keep practicing. So we breathe in, ribs go wide, we breathe out, the ribs come down, but we also start to flatten. As long as you're not seeing a rise of this lower tummy, then you're doing it right. What we don't want is people starting to sort of push their bellies up. So that would be increasing intra-abdominal pressure around the area where you don't want it. So let's try a couple more. So we breathe in, we breathe out, the ribs come down, and we start to flatten here.
Your tummy.
So now let's take it a little step further. So now I want you to imagine that at the front of your body, don't move, I'm just going to demo. At the front of your body, you've got a string, and it's going from your hip bone to your rib. And as you breathe out, I want you to imagine that you're tightening that string inside. So we're not moving the pelvis, we're not pushing the back into the floor, nothing like that. I want you to imagine an internal string, and it's almost like a cross. And as you breathe out, those two strings just simply tighten up inside. They're not tilting, they're just tightening. So let's have a little try of that. So we breathe into the ribs. We breathe out.
And breathe out.
Ribs come down, and start to imagine you've got a little bit of tightening going on through here, like two strings. This is the hardest part to get right, because when we've had abdominal surgery, this whole function becomes disrupted, so our brain doesn't connect with these muscles. So this is retraining our brain to reconnect with the deep core muscles. So let's try that again. Breathing in, breathing out. See if you can feel that crossover feeling of those two strings tightening up inside. Have a breather for a moment. So again, you can practice that in standing or in a seated position. Just practice it as often as you can, because it's very much a kind of way to get your brain to reconnect with the muscle. This isn't about strengthening, this is about function and reconnection. So it's really safe to do really early on. Now let's see if you can feel the muscle tightening this time. So we're taking it another step forwards. So feel your hip bones here at the front. And you're going to kind of come into your tummy a little bit and just kind of have a little gentle poke. So not pressing around your stoma or any wound sites, but just have a little press so you can feel the deep muscles. Now this time as you tighten those strings, I want you to see if you can feel anything under your finger. Can you feel the muscle become a little firmer? So we breathe in, we breathe out, the ribs come down, we tighten up our strings, and if you're lucky, you'll feel the muscle just in your tummy just becoming a bit firmer, and you can feel the tautness. So now you know you have recruited your deepest core muscle. If you're not feeling tautness, then all you have to do is practice this, because it will come. It can take a day or so practicing, but suddenly your brain goes, ah, I know what I need to do. So we breathe out, the ribs come down, we tighten the two strings, and we feel the tautness here. So don't worry if you're not feeling it. If you are feeling it, great. If you're not, practice. Okay. Is everybody with me so far? Everybody okay? This isn't easy, by the way. Not physically easy, but not mentally easy. We have to really concentrate. Let's move on to an exercise called a pelvic tilt, something that probably everyone's very familiar with. If you've had back problems or if you've had children, you're often given a pelvic tilt as the first exercise to do, but a lot of people do it wrong. So I'm going to teach you the perfect pelvic tilt. So things to look out for not doing. What we don't want to do is kind of jam the back into the floor firmly, because that creates too much intra-abdominal pressure. So we don't want to push the back into the floor. Remember, this is all about reducing pressure around the stoma, any wound sites, and around your abdomen and your pelvic floor. So if anybody out there has got a pouch, or you've had a pelvic or rectal surgery, this is also really important to reduce that pressure there. So what we don't want to do is jam the back into the floor. Right. What we want to do is a smooth, controlled tilt back and then release. So we don't want to push the legs. So bring your hands into a diamond shape like this. Thumbs together, fingers together. Place them on your lower tummy. So your thumbs are in your navel, your fingertips are towards your pubic bone. We're going to completely relax. And then we're going to imagine there's a marble inside your fingers. And that marble is going to roll back and forth. So we're going to start with our breath. So we're going to take a breath in. And we're going to breathe out. And as we breathe out, we roll the marble towards our thumbs. And what happens is your pelvis will tilt backwards, very subtly. And then we breathe in. And we let the marble roll to our fingers.
It's supposed to be here. When it comes up.
So we inhale, we exhale, and we roll back. So as you're breathing out, the ribs are coming down and the pelvis is tilting back. So we've got this lovely, safe pelvic tilt movement where we are kind of getting a scooping feeling here. So let's just go through that again if anybody's lost. So we want to imagine the marble in our fingers, sitting in the centre, and we're going to roll it to our thumbs. So we breathe in to prepare.
Roll it up to your thumbs.
We breathe out. And we roll the marble slowly to our thumbs, tilting back, getting a scooping and flattening feeling, and then release. It's a really simple, gentle pelvic tilt. It's smooth and flowing. See if you can do a couple, maybe 3 or 4 of those in your own time. Always with the breath. Breathing out, you get a tilt. Try not to push too much with the legs. And then a release. So you're initiating it with this deep core muscle. So we tilt back and release. So we're starting to wake up these deep abdominal muscles. There should be no pain or discomfort. You might occasionally, if you're newly post-surgery, have a little bit of a tugging feeling. That's normal, that's okay. We can start to just feel it through gently. And then release. Good, a couple more. Breathing out, flattening. So we're not getting any rising here, we're getting a flattening. And back. Good. So that's our pelvic tilt. So if you're going to do these on your own, I'd recommend maybe just starting with 10 or 12 of them. But the way you do them in terms of perfect technique is way more important than how many you do. So just really slow engagement through here and kind of tucking in, okay? Let's move on to another movement. So this is called knee rolls. So now we bring our knees together and our feet together. We're still in this kind of position where we're lying on our back with our knees up. So this is a really nice one to do in bed, actually. So we're going to have our arms a little bit further out to the sides. And we're very gently just going to allow both knees to come over a little way, not the whole way over. So that they roll across and then they come back up to centre. So we roll across and you see my foot is stacked on top of the other, so it has the effect of lifting and then back.
No, wrong, stop it.
Other side, really gentle.
Now watch where her feet go.
That's
Now
good.
watch her feet under her.
Take your time. Louise, just pop yourself on mute, my love, because we can hear your I love how you're coaching, Ron, but just pop yourself on mute, and then if you want to chat to me, that's it, thank you. So really gentle with these, super slow and controlled. So keeping the weight heavy through your feet. And what this does, it starts to increase your confidence, starting to get that, moving your knees away from your midline, particularly if you've got, if you're newly post-surgery. So this is safe and appropriate. Now I want you to think about bringing a little bit more intention to it. So think about the muscles you need to use to lift your knees. So your knees are here. We need to use the waist to draw the legs up. So think about using this waist a little bit more intentionally. Keep your shoulders on the floor, coming up. Good, nice and controlled and steady. So again, we would want something like 10 or 12 repetitions of these. You could put the two things together and then rest. Good. So there we've got knee rolls and we've got pelvic tilt. So two of the most sort of exercises we teach, often post-surgery within days. So, but if you haven't done this kind of thing before, this is the place to start. Right, the next one is a little bit more challenging, not physically, but in terms of how your brain is connecting with this muscle. So we're going to go back to seeing if we can get this contraction through here. So take our knees, keep our feet where they are, so knees and feet are together. So this time, instead of moving both knees across, we're just going to allow one knee to drop from the centre and come back up. But we must do it with a really connected abdomen. So we're going to start by setting ourselves up with a breath. So we breathe in, we breathe out, we flatten our tummy, we pull the strings and we get connection. And then holding this connection here, holding the muscle in a contraction, we then allow one knee to just drop gently a little bit away. from the centre, and then it comes back up. And then without moving anything, we go to the other side. So that knee is just dropping a little tiny way. So you can see here, you know, we're literally doing that and back. It doesn't have to be very big at all. It's a tiny, tiny movement. And then back, good. You might only manage 4 or 6 until you feel like these abdominal muscles have had enough, so in which case have a rest, and then try again. If you feel like your hips are rolling, then you haven't got control here. So stop, reset, try a breath in, breath out, connect, tighten up your 2 strings and hold. When you've got that connection, then we allow that knee to drop. Try again, little drop and up. So nothing is moving. Imagine you've got a champagne glass on each hip, and as you move, you don't want that champagne glass to move. So 1 knee drops. Just try 4 or 6 reps. See if you can keep this contracted, and then rest and have a breather. Good, well done. So those would be the 3 kind of the first exercises we taught in hold. They're all about teaching, well, there are 3 different things. One is about connecting and contracting the muscle. One is about initiating a movement with a pelvic tilt. And the other one is about getting the contraction and then challenging that contraction with a knee drop. So we're really bringing a deep focus to what's happening in these abdominals. And that's a really good thing. We need to isolate it, rebuild the function. So we don't just mindlessly do our knee rolls and mindlessly do, it's about concentration and focus. Okay, come over onto your side. So let's just shuffle over, keep your head down, and then have your head on something so you're kind of comfortable. And come into this kind of tucked up lying position. Again, this is a really nice one to do in bed. So come into this lovely little tucked up position here. I'm going to place our hand on our tummy. So really important that we learn to allow the abdominal muscles to relax as much as we learn to contract. And so we have the control about relaxing and contracting them on our choice, okay? So from this position here, we're just going to completely relax, but your hand is on your lower tummy, so just above your pubic bone. And it might be that you kind of feel like your belly is kind of dropping down towards the floor, and that's normal, and that's fine. If you've got a hernia, it will feel like it wants to sort of drop to the floor. So bring your hand around that tummy. So we're going to keep working with the breath. So we're going to breathe in, and the hand is going to expand and your belly will expand. Don't force it, but just allow a gentle expansion. And then breathe out and see if you can draw that belly in. Breathe in and completely let it go and relax. And breathe out and draw it in. This is a really nice one to do in bed. Breathing in, allow the belly to soften. Breathing out, and see if you can really pull that belly in and away from the floor and draw your hand in. And depending on which side your stoma is, or which side you've had surgery, this will feel different whether you're on your left or your right. If you've got a particularly sizable hernia or an uncomfortable hernia, you might find it easier to do with the hernia at the top. So experiment with left and right and see which side feels best. So again, we would do maybe 12 repetitions of this, but again, slow and controlled. So we're breathing and breathing out and drawing these muscles in and get that contraction. And then maybe you can hold it and see if you can hold that contraction. Not your breath, hold the contraction. So you're drawing your tummy in away from the floor, and then we allow it to relax and go. So a lot of people find it difficult to relax and let the belly just go because they're very nervous of what's going to happen. So just have that confidence. We're not bulging the belly out, but we're allowing it to soften. So we're allowing the muscles to relax, and then we're bringing in some contraction and control. So this can be, if you're very nervous about your abdominals, this can be a really good starting point to start to wake them up and to bring yourself a bit of control. Just going to check on timing. Just practice that for one more second. What time does this finish? 12 o'clock. Sorry, I've got 5 more minutes. Okay, so we're now going to move to our hands and knees position. So those of you who are able to come into this position. So we're in our hands and knees. If this is really difficult, what you can do is also do it standing with your hands on like the kitchen counter or a worktop or a table, back of a chair. So you're doing it standing. But if you want to just watch this or you want to have a go, we're going to come into this box position. Okay? So we want to try and make sure, and if you've got a particularly uncomfortable hernia, this is going to feel quite vulnerable, but that's fine, don't worry, you are safe. And I'm going to teach you how to recruit these muscles. So we stay in this box position. Now we've got gravity pulling everything down. So this is a little bit more of a vulnerable position to be in. So we're going to take a breath. We're going to keep working with this breath. We breathe in, and you're going to feel a softening through here. And then we breathe out, and I want you to feel like you're pulling your belly away from the floor and flattening your back. So breathe in and just let your belly soften. We're not moving the back, keeping the back still. It's just the belly. And then we breathe out. And you pull the belly away from the floor. Now, the next thing, so the last thing we're going to do, and then we're going to have a little question time, is little pelvic tilt in this position. So this time, we're just going to do a little tail tuck. So we're not going to push forwards like this. We're just going to tuck so the thighs stay still. There's the pelvic tilt, but in a different position. So I want you to think about scooping the abdominals in here, this low part, just above your pubic bone. But make sure that you're not pushing forwards, because that's going to create more pressure, not less. So we take a breath in, we breathe out, and as we breathe out, we do our little tuck just of our tail, scoop the tummy in, and then we release. And again, breathe in, breathe out, little tail tuck, and release. One more time, little breath in, and breath out. Little tuck, just a tuck, feeling like you're drawing in here, and then rest and break. Good. So, that's just a rundown of some really simple starter exercises. Now you would progress from those, but that's just a starting point, just to give you some ideas. So to recap, we've got just diaphragm breathing. So where we're starting to learn to recruit the diaphragm, and the pelvic floor will be coming with it. And what that does is it starts to use our brain to connect with these deep abdominals, so you can feel the muscles starting to contract. We then do our pelvic tilt exercise on our back. We've got our knee rolls from side to side, and then we've got that knee drop exercise, which is a little bit more challenging, where we drop a knee whilst keeping control. And then you've got the final movement of a pelvic tilt in a box. Now, these are all exercises that I teach in my classes. Basically, where I teach, it looks like this, we do it like this, and those classes are the ones I was talking about. So they're going to be available for funding and for people to apply for funding for. If you don't get into those, there's some videos you can follow online as well. And also the Combat Technique Plus program that I wrote has all those exercises in it, as well as the breathing. And that's free of charge, and you can just access that from their website. So has anybody got any questions or any thoughts? How did that feel to some of you? Ron, how did you get on with that? Is Ron still there?
All the time, but I did feel some benefit from them. I've been doing them with some of those with Louise, because we've got from the stoma nurse gave some readouts that I've been following. So some of them have been similar to this. Yeah, I enjoy them, but I may not be doing them correctly all the time.
I think I've made a mistake, Sarah, doing them with Ron, where I've got him to tighten his stomach quite tight. And maybe that's, but he's got the benefit from that, but I don't know whether it's too tight.
Yeah, you don't want it to be like a bulging and bracing. There's a subtlety to it. And so, yeah, you want firmness, but not like a bracing. And if you feel the muscles, if you can feel his belly and you're feeling like the muscles are kind of pushing up, it's probably too strong. So it needs to be more of a feeling of drawing in and pulling in. And that's where we get the reduction in pressure. Sometimes we brace too strongly and that can press the belly out a little bit, if that makes sense. Is that what kind of feels right?
Yeah.
So people make a mistake by trying a little bit too hard with them, which is great because you're having a go at them and that's brilliant. But there is a subtlety, so you don't want to be going at them too hard. So yes, think about subtle but focus. Yeah, cool. But you're doing those sorts of things already, are you?
We've done a few times already this week.
Great, fantastic.
Yeah.
Great. So just keep doing what you're doing. But then we start to progress. So there's things that kind of layer up on top of that after that, and you can start to add more things, challenge it in different ways, and do it in different positions. Has anybody else got any comments or thoughts or questions at this point? I think we've just got another couple of minutes.
Yes, please. Yes, please.
Yes, okay, hang on, let me just see. Who is this?
Alison, yeah.
Alison, right, go ahead.
I can't kneel down after total knee replacements. So could you just demonstrate once again how to do that last exercise?
Yeah, sure. Let me just adjust my camera and I'll get a chair. Hang on one sec. So, if you want to do that pelvic tilt and you can't kneel, this is a really, really good alternative. So you just get into a similar position, your feet are quite wide, and you just do exactly the same thing. So you want to be sort of here with the chair, you want to be kind of step back, and slight bend in your knees, and then we just do a tuck and scoop. So you're drawing those abdominals in and getting that scooping feeling, and then the release and then scoop. How does that feel? I don't know if you're doing it along with me.
I'm not doing it, but I will try that, and now I can see the position. That's helped. Thank you.
Yeah. So that's the option of doing it if you can't kneel.
Right.
Or you can kind of, you can kind of come here and do it like this. I prefer it like this, but as long as you're not like hunched up. So it's very much like just lean forwards and then try and get the feeling of scooping. What you mustn't do is push. So keep your legs where they are, and it's tuck and release. Does that make sense?
So essentially, you're keeping the box shape.
Yeah.
But at a different angle. So you're still a U shape, and not changing that position. It's only your abdomen that's moving.
Exactly. Yeah. Yes. So you're initiating the movement with these abdominals. Because if you're initiating with your legs, you would just push.
Yes.
You use your glutes and legs to push. So actually, what we're looking for is a tuck here. So everything stays the same, apart from the pelvis. I mean, you can do it in standing as well. So you can do it. You can just do it like tuck. But that's much harder. People find that really difficult just to do it in standing. So I prefer to do it leaning over something.
Right.
You're keeping the similar shape, similar to the floor. It's just a modification. So that will work just as well.
Yeah, thank you very much. Thank
Pleasure.
you.
Anybody else got any questions? And then you can come and have your lunch. Lucy, are you all right there? I can see you on camera, my love. Are you okay?
Yes. Yeah, it's good. It's quite hard to get your head in gear.
It is. Absolutely. And that's the hardest part.
Yeah.
So your brain to do what you want,
Yeah.
what you want these muscles to do. It's not about the strength of the muscles, it's about the recoordination of muscle and brain. And that's the critical
It's not like
part.
normal
Most people
exercise
miss.
where you're just, yeah, like in compared with like just running or walking or something like that, you're having to get your brain in gear. Yeah.
And what's so important about it is we need to kind of isolate it and give it some focus. And then when you go back to doing all the other stuff, you don't need to think about it because you've spent some time retraining that process. So that when you go and lift something heavy, or you lift a child, or you pick something up or pull something, your muscles are going to know what to do, and they're going to create that kind of internal brace, and they're going to function correctly because you've trained them to do it. And you don't need to think about it. So it's about then joining the dots between this isolated rehab process and then it becoming part of everyday activities. If that makes sense.
Yeah, definitely. It was good.
Good. And that's just a taster, a starting point, and you can kind of progress on from there. Anybody else got any questions? No? All good? Brilliant. Well, thank you for joining, and go and have your lunch. And I'll see you again later on this afternoon for the panel session.
Thank you ever so much. Thank you.
Thank you.